Welcome to the clinical skills video for the intravenous infusion setup. Prior to performing and delivering intravenous infusion to the patient, you must ensure that you have the appropriate patient and that you have confirmed the identity of the patient. Ensure that they have inquired about history of any allergies or adverse reactions. You must ensure that you then wash your hands thoroughly using the 11-stage approach. You must check the prescription chart to ensure that the appropriate drug has been prescribed. You must check that you have the right patient, right drug, right dose, right route and right time. You must also ensure the bag is clear with no sediment present. If sediment is present, change the bag and report it to the manufacturer. You must ensure that you've assembled the correct equipment. This includes your IV giving set, drip stand, syringe and saline, the fluids themselves and a drawing up needle if required. Having washed your hands and applied non-sterile gloves and an apron. The tray will have previously been cleaned prior to assembling your equipment with the appropriate wipes and allow this to air dry. You must then remove the fluid bag from the sterile pack. You must then open the IV giving set, ensuring that the regulator is turned off prior to connecting the IV giving set to the bag of fluid. This must then be connected to the bag of fluid, ensuring that a non-touch technique and ensuring that the key parts are not contaminated. Once you've connected your IV giving set to the bag, you must then also prepare your syringe and saline. This may be a pre-prepared syringe depending on the clinical area in which you work, or it may be that you have to assemble and draw this up yourself using a 10ml syringe, a 10ml vial of 0.9% normal saline and a drawing up needle. If drawing up the fluid yourself, ensure that you're maintaining an aseptic non-touch technique at all times. Once you've assembled all this equipment, hang your bag of fluid onto a drip stand. Fill the chamber to the fill line, which is about halfway up. And then undo the regulator on the IV giving set until the fluid starts to fill the set, avoiding any air bubbles and ensuring that there is no air within the giving set. Once the set is fully primed, clamp off the giving set again. You must then give the bung or the extension set where you're about to connect the IV fluids onto a thorough clean for 30 seconds and allow to dry for 30 seconds. Before flushing the cannula to ensure its patency prior to connecting the fluids. If the patient complains of any pain, you see any swelling or redness around the site, or any edema, this may be an indication that the cannula is not patent and therefore do not proceed with administering fluid into this site. Once you are happy with the patency of the cannula, you can then attach the IV fluids to the bung or octopus or extension set that is being used, ensuring an aseptic non-touch technique at all times. Unclamp the line and adjust the regulator on the flow set until you get the appropriate flow as calculated. In terms of calculating flow rate, we have a brief example to the side of you. Check for any leakage and that the patient is comfortable at all times and ensure that you've appropriately documented this in the patient's drug administration chart. In summary, prepare the patient and confirm their identity. Wash your hands, check for any allergies and adverse reactions. Assemble and prepare all equipment and drugs, ensuring an aseptic non-touch technique is maintained. Prime the IV giving set. Flush the cannula to assess patency prior to use. Connect the IV fluids. Calculate the fluid drop rate. Provide any aftercare advice and ensure the correct documentation is filled out in the patient's notes.